Hi everyone, I'm Sylvie from HR.com and I'll be your webcast host today. Welcome to Preventing Discrimination and Providing Quality Benefits for Employees with Migraine Disease, sponsored by AIMED Alliance, the Headache and Migraine Policy Forum, and Migraine at Work. This webcast has been pre-approved for HRCI and SHRM credits. Please be sure to attend the complete webcast in order to receive your credits. If you have any questions today during the webcast, please click on the Q&A tab on your webinar controls and type them in there. You'll also notice the chat function, which you may use. And it's now my pleasure to turn you over to today's presenters.
Thank you, and good afternoon, everyone, and welcome. I'm Stacey Worthy. I'm counsel to AIMED Alliance, and today we're joined by Paula Dumas, the CEO and Managing Editor and Chief Encouragement Officer of Migraine Again, Todd Meyer, Lead Vocational Case Manager and Coordinator for the Workplace Possibilities Program at Standard Insurance Company, Louise Serio, Project Manager for Migraine at Work, Lindsay Videniak, Executive Director of Migraine and the Headache and Migraine Policy Forum, and John Wylam, Staff Attorney for AIMED Alliance. As mentioned, this webinar is co-hosted today by AIMED Alliance, the Headache and Migraine Policy Forum, and Migraine at Work. And here are the organization's mission statements. So today, we're going to start with an interview to hear the patient-employee perspective of migraine in the workplace. We'll then receive a legal and policy overview as well as recommendations for best practices. From there, we'll learn about the underlying challenges for employers and employees, the role of benefit managers and disability insurance, and the process of working through reasonable accommodations. Then we'll hear about a new platform offered to employers with tips for building a positive workplace. We'll conclude with a Q&A. So I'm going to turn it over now to Lindsay.
Thank you, Stacey. This is Lindsay from the Headache and Migraine Policy Forum. Thanks to everybody who can join. So as Stacey mentioned, we really want to kick off the program today by hearing first from the migraine patient advocate and Fortune 500 marketing executive, Paula Dumas, because we think that being patient and employee focused is important. And so that's why we're starting and framing it this way. So Paula, before you and I sort of begin our discussion, could you provide a quick overview of your career highlights as a person living with migraine disease?
Sure, thank you, Lindsay, and great to be here with all of you guys today on HR.com. I'm Paula Dumas, and as Lindsay said, I spent the first half of my career in Fortune 500 companies like Disney and Apple and CNN and a couple of others, which I'll talk to you about in just a second. And now I have the opportunity to serve as a patient advocate and use some of my skills in media and marketing and technology to help reach more people out there who have migraine and encourage them, frankly, to reach a level of wellness that I didn't have in my younger years. So grateful for that opportunity and for the chance to be here today.
Thank you, Paula. Well, we'll kick it right off with some questions for you. I mean, you really have had an amazing career. You've served at the very highest levels of corporate America, as you mentioned, you know, places like Disney, CNN, Apple, Kodak, Frito-Lay. Can you talk a bit about what it was like for you to climb to the top of the corporate ladder, but also living with migraine disease?
Sure. Well, at first, it was not a big problem. My migraine took a turn for the worse early in my career when I was 23 and had a bike accident. And at the time, I was employed at Frito-Lay, and they had just built a beautiful new wellness center. And boy, they were fantastic. They gave me all kinds of accommodations and help, and were very, very supportive. But as I moved through my career and began working at different companies, what I found was that increasingly stigma became a problem, and being open about my disease was not a comfortable place to be. I had shared with you earlier about one of the days when I was at Disney, and one of my jobs at Disney was to present all the new films that were coming out to our partner companies. And so we were launching Toy Story, and I'm standing in the front of the room, and there's a flickering light in my face, which, as many people with migraine know, is one of the fastest and most predictable triggers for an attack. And so I've got a flickering light in my face, and I'm going to throw up at any minute now, and I just have to get through my introduction. And I've got an audience of 50 people in a screening room on the Disney studio lot. I finish my part, I step out, I go, and I throw up. I try to compose myself, wipe the sweat off my brow, and get back in for the second half of the presentation. And so while I was working for an entertainment company, I spent a lot of time acting. And I was never trained as an actress, and I'm not very good at that either. And the reality is that most people with migraine who are in the workplace are hiding it, and it is hiding in plain sight. And so my work today as co-chairing the Migraine at Work campaign, and my work on Migraine Again and the Migraine World Summit, is to help people understand, help employers understand, and people who have migraine understand that this is a problem that can be solved. Through the years, at CNN and at Apple, and then later at Disney and Kodak, most of the people I work with did not know that I had migraine.
So it sounds like, you know, it's partly the stigma, as you talked about, the hesitancy to talk about it from an employee's perspective. But, you know, what can employers or HR benefit managers or other folks who are in positions of authority do to help reduce that stigma in the workplace and make it more inviting for you to seek accommodations and in that way?
You know, that's a great question. I think having an ability to be open about my disease would have really helped my employer. It would have helped me be more productive and delivered higher value. But in these environments, in highly competitive companies, we're kind of trained to not show any vulnerability or weakness. And migraine, and frankly, many invisible illnesses are deemed to be a bit of a weakness. It tends to marginalize your opportunities, which were pretty important to me early on in my career. I think what employers can do involves creating an open culture where people can share the things that they're physically struggling with. Encouraging senior leaders, and I regret that I was not open at the time, senior leaders to share that vulnerability and to share some of those things that they're struggling with, so that those who are younger feel like they can also do the same. Making accommodations and promoting wellness and making migraine part of a wellness program is certainly a positive step. And then encouraging people to actually get treatment. One of the research studies I think we may look at later in the program showed that most people who are not getting the kind of medical care that they could get to get it under control before it progresses from episodic to chronic and really derails somebody's potential.
Thanks. You know, a good point to bring out, June is Headache and Migraine Awareness Month. So if for HR benefit managers or other folks on the call who are looking for a way to maybe highlight the disease state without pointing out any one particular story, that probably is a good way to help others feel open about talking about it. So Paula, you talked a bit about Frito-Lay previously. Were there wellness programs or accommodations that really stood out to you, and why do you think they were so effective?
Yeah, they had it may be ironic to some people that a company that makes snack food is so progressive on wellness, but Frito-Lay and the parent PepsiCo definitely was. And they built a state-of-the-art fitness center. And when I shared that I was recuperating from this bike accident and was battling migraine, they encouraged me to get treatment right away. I was working out twice a day at the time, and they literally assigned one of the trainers there to work with me on craniosacral massage. So how about that? You know, a shout out to them for an incredible program. You know, Kodak was very flexible when I needed to take FMLA. Apple was very accommodating, but I was very much in hiding at that time, and kind of faking feeling well. So they really didn't know what I was struggling with. And when I was hospitalized during my Disney days, they had no idea why I was hospitalized because I wasn't telling anybody. It wasn't really safe to do so. So I can't really fault them for that. That was my own thing that I didn't share, but some companies are doing this very, very well.
Well, let's switch gears for a moment and talk about sort of the cost benefits of the return on investment. You know, why do you think employers, besides caring about their employees, why do you think they should invest in providing support and resources for people living with migraine disease? What's in it for them, per se?
Yeah, actually, if you can go back 2 slides, Stacy, I want to show something in terms of my career progression. The reason why it comes down to the bottom line. It comes down to productivity and retention, and the cost of turnover is extremely high. So as I said, I was open about my disease when I was at Frito-Lay, but then I began to hide it. And so then I started feeling the stigma. I was hiding, I was faking, I was hospitalized, I took FMLA. And then ultimately, you know, as a pretty senior level, you know, vice president on a track for top leadership in the company, I took early retirement. And they're scratching their heads why. You know, why would I do that? And I think a lot of companies are losing women in their late 30s, early 40s, and they don't really know why. And oftentimes it's because we cannot share. So retaining key talent and offering them kind of the quality of life so that they can provide stronger value to the company is the primary reason why I would encourage companies to create wellness programs that retains those people. The rest of my career kind of took a complete sidetrack, and I'm really thrilled with the opportunity to have worked in nonprofit and to now be in a position to be able to do patient advocacy and research and publishing in this space. But I think if you look at it through the corporate lens, you'd much rather hold on to those people and have them in C-level positions in the organization rather than lose them.
Absolutely. And so, you know, reversing that, why do you think an employer should hire someone with migraine disease, you know, whether they know it or not, but in terms of are there benefits to having folks living with this condition and being able to manage it?
Yeah, there are, and they're kind of strange to think about, but I actually wrote a piece on this, and you know, Thomas Jefferson wrote the Declaration of Independence coming out of a terrible migraine. We've got some great historical evidence of all kinds of incredible people like Julius Caesar and 5 US presidents doing incredible things while dealing with migraine. And you definitely want to hire them, right? Wouldn't you? So Stacy, if you could click ahead 2 slides for me.
Mm-hmm.
This one, or that one, actually, yeah. It's purple for Migraine Awareness Month, but the 10 reasons I would contend you want to hire or keep a person with migraine. Number 1, because migraine can attack at any point in time, we have to be really disciplined time managers and work ahead. And every person I know who's in an important job is really doing that. They're working ahead so that they have a plan B if a migraine attacks. People with migraine typically deliver on their commitments and over-deliver if you give them flexibility. And you can't say that for everyone, but we are so concerned about keeping the jobs that we need that I find that to be true. I think anybody who has to deal with constant and unpredictable change masters coping skills and agility. So that's number 3 and 6 there. There's actually some research that says that our brains shine between storms. So while I might be kind of foggy if I'm in the middle of an attack, when I come out of the attack, I can go into periods of hyper lucidity where I can, you know, really crank. And so if there's crank mentally, if you will, there's really some data that supports that. So it's a fascinating way that the brain works. I find that most people who have migraine have extraordinary empathy for their teammates, even if they don't have migraine, but they have some other kind of chronic disease, whether it be diabetes or asthma or fibromyalgia or depression. And empathy is in really short supply in organizations these days. So that's a really strong thing. I mentioned agility, resourcefulness versus obstacles. The obstacles come up all the time. There are as many as 40 different symptoms of migraine, not just headache. And we have to navigate our way around inconvenient dizzy spells or, as I mentioned, the vomiting episodes in the middle of a Toy Story presentation. There's a lot of rare talent in the community. Talent does really not discriminate against people with migraine or without. And then you might be surprised, but we really avoid calling in sick because keeping our word is a really important thing. And finally, I think that people with migraine have resilience in spades, or what Angela Duckworth would call grit. Anytime you face a frequently disabling, unpredictable attack and you bounce back from that, that builds resilience. And that's something that I love having on our leadership team. We have all people with migraine in our organization, and I appreciate very much about the people in the community who we work with.
Well, Paula, this has, I think, been incredibly important for folks to hear. The reason why, as I said, that we started with your story. So I think you've given folks a lot to think about, so thank you. Before we turn it over to John, I just wanted to make a quick mention of a project that Paula and I are working on together, and you'll hear more from Louise Serio of the Migraine at Work campaign, but we're essentially building a business council for migraine progress, and that will spotlight selected companies that have really shown leadership in this space. So as I mentioned, Louise is going to share more about that at the end of the webinar, but I just wanted to frame it and mention the exciting opportunity before we turn it over to John. You'll be able to find more information about it in the attached resources that they're provided after the webinar. So with that, if we could progress to the next slide, I'm going to turn it over to John, who will talk about cost-effective benefits.
Hi, everyone. My name is John Wylam. I'm the staff attorney from AIMED Alliance, and I'll be speaking to you today about cost-effective benefits that improve access to care. So many Americans are uninsured or underinsured, which can inhibit their ability to access healthcare. And a leading cause of underinsurance is high deductible health plans and burdensome cost-sharing requirements. So when someone is underinsured, their health plan does not provide as much utility as it could. For people with migraines, being under or uninsured can result in conditions being underdiagnosed and not treated. And so that's associated with increased emergency room use and less preventative care. And relying on the ER for healthcare needs is associated with higher costs for the individual and the system. So individuals with undiagnosed, unmanaged, or undertreated chronic conditions are more likely to experience disease progression and lower quality of life. Because of the benefits that they offer their employees, employers are in a unique situation to address some of these issues. And as HR professionals, you play an important role in this process. So we recommend that employers carefully select the health plans that they will be offering to their employees and try to create a welcoming environment for employees. I'm going to spend some time providing you with an overview of some features of health plans that you should be aware of, and this should hopefully assist you in selecting a benefit package that is most responsive to the needs of your employees. Individuals living with migraine disease may need access to neurologists and other types of specialists, but some variations in plan design could influence your employees' ability to access these types of providers, and I'll briefly cover some differences between those. For an HMO, enrollees cannot see providers who are out of network and will need a referral to see a neurologist. And the benefit of this type of health plan is that it comes with lower premiums and deductibles. For a PPO, enrollees don't need a referral to see specialists, but this type of plan will have higher premiums and deductibles. EPOs are similar to HMOs, but enrollees will not be required to obtain a referral to see an in-network provider. And finally, point-of-service plans will require a referral to see a specialist, but enrollees can visit both in-network and out-of-network providers. So the lesson I want to leave you with here is that lower costs for these plans will come with some trade-offs, which often come in the form of access restrictions. While in some instances those could have little impact, they could act as a barrier for an enrollee to see specific types of providers that are necessary for them. Individuals with migraine disease have certain needs that can be addressed by your health plan, and that includes access to specific medications, access to tests and diagnostics, including MRIs, CT scans, and lumbar puncture, nutrition counseling, access to treatment for comorbidities that are associated with migraine disease, and that includes mental health, obesity, and pain. And individuals with migraine disease could also require access to alternative types of treatments, such as cognitive behavioral therapy or craniofacial massage, as Paula mentioned earlier. So if you happen to know that one of your employees has migraine disease, we recommend that you consider these factors when you select the health benefits for your employees. So there are a series of other types of access restrictions that are known as utilization management strategies. I'm going to walk you through each type of utilization management strategy, explain what they are and how they can impact access to care. I'm also going to provide an overview of some laws that are in place that restrict these practices. What I want to emphasize about these policies is that they're often one-size-fits-all solutions to healthcare problems that are often unique to each individual. These policies often sweep individual patient needs to the side in favor of uniform cost containment measures. Sometimes these can be detrimental to patient health outcomes. And so the first strategy that we're going to cover is step therapy. Step therapy occurs when a patient is prescribed the medication by their doctor, but the insurance company will not allow the patient to access that medication until they try and fail on a different one first. So that alternative medication is often less expensive, so requiring the patient to try that medication before accessing the one that was prescribed does help the insurer contain costs, but there's no guarantee that the patient will obtain that same benefit from that medication. In fact, there are some conditions that manifest differently in each patient, and this can cause them to only respond to specific therapies. If they can't access the treatment that they know is going to work for them and successfully manage their condition, it can create access delays and care delays that can lower their quality of life and result in disease progression as their condition goes unmanaged. So step therapy is a very popular topic among health advocates because of the care delays it can cause and the inherent unfairness that's involved. So for example, there's instances that occur where a patient knows for a fact that they're not going to obtain any therapeutic benefit from a medication that they're forced to fail on, but there's not always protections in place to allow them to stay on their current medication that they know is working. So in the past year, several states have enacted step therapy laws and several others have introduced legislation. The states that passed step therapy laws are listed on the screen for you on this slide. So these laws will commonly regulate how step therapy protocols are developed, how they're used, and how patients can request an exception from the protocol. And federally, the Safe Step Act of 2019 has been introduced in Congress this year. This is a bipartisan bill that has received broad support so far, and it would simply require that group health plans, such as those provided by employers, are required to provide an exceptions process for step therapy protocols. So this hasn't yet passed, but we're keeping a close eye on it. So prior authorization is the next strategy, and it's a requirement imposed by insurers that forces patients to request an approval from the insurer before the coverage for the treatment is authorized. So this, like step therapy, can cause treatment delays for patients and administrative burdens for providers, as they will be required to fill out paperwork associated with the request to affirm that the prescribed medication is medically necessary. So this practice can be particularly bothersome for providers because insurers can require different paperwork for every different type of treatment subject to prior authorization. And so some practitioners have started charging patients for the time that they spend filling out that paperwork, and that can create additional costs for patients. I just want to point out that an insurer's definition of medical necessity may not be consistent with widely accepted clinical standards, and that can be frustrating for both patients and providers. So states have enacted laws that regulate this practice, and some of those streamline the process. They may require insurers to accept electronic prior authorization paperwork, and others may require insurers to adopt evidence-based standards for medical necessity, like I just mentioned. So several states have enacted laws in the past year that regulate prior authorization, and those are listed on the screen for you. I'm going to skip over this federal bill because it doesn't regulate employer-sponsored plans. So the next strategy is non-medical switching, and that is a cost-driven coverage change that forces stable patients to switch off of their current medication and onto an alternative medication. So this often occurs after the plan year has begun, and that leaves patients with fewer treatment options at a time when they're unable to enroll in a different health plan that can cover the treatments that they need access to. So similar to step therapy, non-medical switching can cause an enrollee's condition to progress when they're unable to access the medication that they know is going to work for them. To address this issue, a few states prohibit these types of mid-year formulary changes altogether. Connecticut and Maryland take a slightly different approach by allowing the mid-year switch, but forcing the health plan to provide continuous coverage of that medication for enrollees who are currently taking it. And recently enacted laws in Illinois and Maine prohibit plans from removing a medication from the formulary or changing its cost-sharing status without 60 days advance notice to enrollees. And those new laws also require those health plans to allow patients to continue receiving coverage for the medication that they're stable on if their provider attests to medical necessity. So the next one is quantity limitations. That's a little bit simpler compared to the other strategies. And that simply limits the number of doses of a medication that can be dispensed to a patient in a single month. This can be an issue for some patients because the number of doses of a medication that they need may not be uniform. Some might just need a few doses a month, while others need several per week to manage their condition. So on this next slide, we have an excerpt from a New York Health Plan's formulary from this year. And I'm sharing this with you because I want you to take note of the number of restrictions that are placed on these migraine treatments. Most of these are going to require step therapy, prior authorization, or they'll have quantity limitations. So only 2 of these don't have any restrictions at all. So what I want to leave you here with is I want to encourage you to pay attention to these types of restrictions to gauge how comprehensive the health plan is that you're selecting. If the formulary is rife with these kinds of access restrictions, your employees may have a very difficult time accessing treatments that work for them. So this is another example that I'm just going to skip over in the interest of time, but we're now going to turn to copay accumulators, and these are a little more complicated. They're a rather recent invention. Because of how expensive some medications are, some patients have come to rely on financial assistance from the medication's manufacturer to fill a prescription for that medication. A copay accumulator is a policy that will exclude the value of that assistance from an enrollee's deductible and maximum out-of-pocket costs. So when that occurs, the health plan receives the value of the financial assistance, but the enrollee does not make any progress through their deductible, and that extends the time that they're in that phase of their health coverage. This can result in increased costs for the patients. And so we've seen some plans that use confusing language when describing these policies, which can create confusion and distress for patients. For example, a patient could believe that he's completed the deductible phase of coverage through their financial assistance from the manufacturer, but they could be very surprised when they're charged for services that they thought their plan would be covering more fully. A policy like this could impact neuromigraine treatments, as it's been common for newly approved treatments to launch with very high prices. So some patients might try to sidestep this issue by using a generic instead of a brand name drug, but for some treatments, there's not yet a generic substitute or equivalent. And I also want to just mention that financial assistance is not a bottomless well. Some financial assistance will only be available for part of the year, and patients would ordinarily be able to rely on that to complete their deductible. However, if there's a copay accumulator policy in place when a patient's financial assistance comes when it runs out, their only option might be able to pay out of pocket for a very expensive medication, and for some that could be unaffordable, so that would leave them with no options at all. This is something to keep an eye on as more employers have begun implementing these policies. And I want to point out that a recent survey by the National Business Group on Health has shown that 56% of large employers are considering adopting one of these policies in the next 2 years. So because copay accumulators are so new, there is a patchwork of legal protections available to patients. For example, the Affordable Care Act has requirements on cost-sharing limitations and non-discrimination protections, as well as requirements to communicate coverage policies and a summary of benefits and coverage using plain language. The Federal Trade Commission has jurisdiction over unfair trade practices, and those could be implicated by copay accumulators. And also, ERISA requires employer-sponsored plans to make certain disclosures to enrollees regarding the terms of the policy. So in addition to these existing laws, the Centers for Medicare and Medicaid Services has recently finalized a rule that it permits copay accumulators to be implemented in commercial health plans, but only when a patient fills a prescription for a brand name drug when a generic equivalent is available. And so we find that this strikes a good balance between the interests of patients and insurers. So there have been a couple states that have taken the lead on passing greater restrictions on copay accumulators. For example, new laws in Arizona, Virginia, and West Virginia require health plans to include the value of financial assistance when calculating an enrollee's deductible and or maximum out-of-pocket costs, with some variation between how the states handle that. But I just must mention that none of these state laws are going to regulate employer-sponsored plans because that's preempted by ERISA. But that should give you some indication of where the thinking is on this and where the future might go. So many of these practices could violate unfair trade practice laws passed by the states, but each state is going to handle that differently. Additionally, there could be considered a breach of contract as well as a breach of the duty to deal in good faith. So we published 2 papers that discuss utilization management tactics in a legal context. They're listed on the screen for you here, and we hope that you'll take the time to review these after today's webcast. Keeping in mind all of what I just discussed, we have some recommendations for you regarding your selection of health benefits for your employees. We encourage you to ensure that the plan you select is ACA compliant and covers the essential health benefits that are required by the ACA. The plan that you select should not be overly restrictive. We recommend that you offer plans that account for the needs of employees with complex chronic conditions. So ensuring that the plan you select does not contain overly burdensome utilization management strategies can be very, very helpful for your employees. So we also encourage you to possibly offer several plan options so that employees can decide for themselves how they want to balance their own affordability and access to care. So also, when you're contracting for your health plan, you can make specific stipulations to ensure that certain policies are not used in the health plan. For example, you can require that the health plan exclude copay accumulator policies altogether. So to ensure that patients can access the treatments that are right for them, you can offer plans with open formularies, and so those will contain minimal, if any, access restrictions. There's also value-based programs that you can use, and some are specific to migraine. And so a value-based program will alter how those treatments are paid for depending on the real value that they deliver to the patient. And regarding appeals, it's best to streamline the appeals processes to make them as simple and fast as possible. If a patient is going to lose access to a treatment, it's best to ensure that they can remain on that treatment while they're going through the appeals process to make sure that their condition does not progress and their continuity of care is maintained. So we also encourage you to play a role in assisting with the appeals to ensure that your employees can access the care that they need in a timely manner. So on the last slide here, I just want to point you to a resource that was created by the Society for Women's Health Research. This is a migraine patient toolkit that assists patients work through migraine diagnosis and treatment. So if you have employees with migraine disease, they may benefit from having access to this resource. And you can find a link to this with the resources included on the webcast page. And I'll now be turning the presentation over to Todd Meyer, who will be talking about the impact of migraine disease in the workplace and how employers can mindfully work through the reasonable accommodation process with employees.
Thank you, John. This is Todd Meyer. I'm a disability and productivity consultant with Standard Insurance's Workplace Possibilities program. And I was invited here to talk a little bit about the relationship between the employer and the employee in figuring out accommodations. Next slide. Migraines being the 6th most disabling illness in the world, and 1 in 4 U.S. households having someone with the condition, it's likely that you're going to encounter fellow employees in your workplace who have a condition like this. Over 4 million adults suffer from chronic migraines on an average of 5 days per month. And then in the disability insurance world, there are an average of 38 lost work days per short-term disability claim and over 138 lost work days for a long-term disability claim. Over 20% of these disabled are comorbid, with 33% being obesity, and under that is mood disorders comorbid with the migraine. The lost productivity and medical cost estimated to be $36 billion annually. And then a total of 157 million work days lost each year due to migraines. And as we found out here at Standard, we don't get as many proportionate claims for migraine as we do, like musculoskeletal disorders and other disorders, but we do get a lot of referrals for stay at work because people want to stay at work. And we have been very successful by creating that open dialogue between the employee, the employer, and the treating providers to get clarity about the triggers of the disease, work with the employee for going through their diary to identify some of the possible triggers at the workplace. And as John pointed out, a lot of migraine sufferers, just because of the cost of the medical care, find it difficult because you have these high deductible plans. And I recently worked with one of our employees here at Standard, with a $4,000 deductible, and it's very difficult. It's very costly. Next slide. So as I was saying, helping people stay at work, we want to reduce the idea of the presenteeism of work. Person's at work, they're suffering, but they're not able to get the help that they need. They feel uncomfortable about approaching their employer. There isn't any open dialogue or intranet site with a wellness program that allows a person to go to a neutral third party to create and engage that neutral interactive process and have their information confidential, so that the accurate through the investigation by a neutral third party subject matter expert can be revealed and provide plausible solutions to accommodate in the workplace. And we at Standard are committed to helping employers help their employees by partnering with them to create that safe, open environment. There are a lot of times there could be something simple, like they move to a different location where the parabolic egg crates on the fluorescent lighting are wider, emitting more light, and there was never a light meter put into the space. By having an ergonomist come out and adjust that lighting, provide shields over their cubes, incandescent lighting, and to replace the high flicker rate of LED lighting, for example, are all ways that we can provide for an employee to help them at their workplace and do the follow-up necessary. Coordinating with the employer's HR department, handling the ADA by helping provide inputs based on findings of the limitations and restrictions discovered through the interaction between the employee and the treating provider really helps provide an accurate, tactical, objectively based road to obtain the right accommodation for that individual. And integrating the benefits by coordinating with the medical insurance and referring employees. We definitely work with medical insurance, EAP, different groups in order to help that person have what they need. They might have some behavioral health aspect going on that could be comorbid with the migraines, and through this investigation and having this confidentiality, this employee can help the subject matter expert by getting this information and providing the right accommodation solutions. Next slide. The invisibility of these disabilities, things like attention deficit disorders, fibromyalgia, sleep disorders, all of these things really impact the presenteeism of the employee at work. And as we were talking about earlier, employees don't want to bring that up because it's hard to describe or hard to prove it or disprove it. And without feeling comfortable in their employment environment, knowing that their employer is advocating on their behalf and has programs in place to help them be able to talk to somebody outside the employer, it's very difficult for them to feel comfortable. And so the anxiety increases with the fear of this disclosure, and with communication with the employer and the employee, and the ability to create an environment that the employee feels safe really goes a long way. Next slide. We've tracked with our stay-at-work referrals here at Standard and found 87% of referred employees chose to participate in an active stay-at-work program. So if there's a benefits provider that can provide a neutral third party to help that employee, these 92% successfully stayed at work as a result of the accommodations. And only 9% of our WPP cases had a subsequent claim for similar condition. 91% of employees we helped stay at work or return didn't have to file a claim. within 24 months. And that goes a long way in showing and illustrating the importance of having that proactive partnership with the employer to help employees and have a place for the employees to go. Next slide. Types of accommodations we find are tinted glasses, for example, glasses that there's a company called TheraSpecs that help filter out some of the flicker of that's caused by ballast on a fluorescent light. Blue light filters on, let's say, Windows 10 has a built-in blue light filter, making sure the employee understands and can have access to these types of options. Scent allergies, so like alternative cleaning supplies. We work with janitors that having issues, people in the medical environments having issues. We try to identify what the source is and help promote alternative cleaning supplies when possible. Pixelated lenses is another example for vision-induced migraine conditions. Next slide. Recently, I pulled a report and we had like 38 success stories already between the end of 2018 and up till now in 2019, July, people with migraine type issues. And commonly we're dealing with, they're moved to a different location, they need bright, dimmer light, they have some scent allergies. Teachers that work in environments with noisy kids, like in middle schools, we help provide noise canceling headphones to help them attenuate some of that frequency that's causing the issues. Next slide. We had one case, for example, here talking about, an employee moved to a different location and it happened to be adjacent to a cafeteria, and through the diary revealing that between like lunchtime around 12 to 1, this sensation would increase, and we found out that the intake vent above the condiments area in the cafeteria was taking in the air, and the outtake vent was nearby where the gentleman was sitting at his desk, and we worked with their facilities to reverse the intake and the outtakes so that it wasn't, creating, pepper scents and mustard and all of these scents that were aggravating the migraine condition. Next slide. This employee had limited vision in the right eye, and a consultation education provided with tinted glasses to filter out the fluorescent light. And also we have situations where the employee is not sitting in the correct posture. If they're leaning slightly forward, they're twitching, they're shrugging their shoulders, they're not aware that they're not naturally loading their shoulders in a neutral posture, it's aggravating their symptoms. So having that ergonomic evaluation, identifying proactive ways they can sit upright and correctly, providing headrests, things that help promote proper alignment. If they're using progressive lenses, for example, making sure that the screen heights are correct so they're not squinting or looking in the wrong way and aggravating their condition. So this is essentially, there are a lot of different ways we work with employees, and the importance is having that relationship, having a neutral third party act as the liaison to coordinate all the different functions and create plausible plan of action for the employer and make sure that everybody's on board. And as a result, we've had a lot of success keeping people at work who are suffering from this condition. And the most important thing, I think, is having empathy, realizing what that person is going through and listening and really, really thoughtfully evaluating and putting ourselves in their shoes. So feel free to go to our Workplace Possibilities website. We have blogs and articles about migraines as well as other conditions and issues that come up. And I'm always available if you ever want to email me and have questions. We have a whole library resource of the work that we have done in accommodations. And we might have an idea or come across some widget or something that might help you. Thank you very much.
Wonderful. Wonderful. Thank you so much. So now we're going to turn it over to Louise.
Thank you, Stacy. So thanks everyone for joining. This is really important, and I'll keep it very short here at the end so that we have some time for questions. You heard Paula and Lindsay open up this webinar, speaking a little bit about the Business Council and some of the work that they've been doing as part of Migraine at Work. And as so many others have touched on, this sort of lack of education about the disease in workplaces does contribute to the stigma, and as a result, a lot of workplaces are not supporting their employees in the way that they could. And so our goal with Migraine at Work is really to help educate workplaces about both like lost productivity and how supporting employees with migraine disease can help reduce stress in the workplace and increase productivity in pretty profound ways. And so I just wanted to take about 5 minutes at the end here to take you through the website that we've developed in collaboration with our partners from the migraine community, and talk a little bit about the Business Council, which is really where we want to put most of our focus as we move this important campaign forward. So if Stacy, you would advance the slide for me. Okay, great. So we built this website, Migraine at Work, as a result of a small employer advisory group that we convened. So we talked to some select employers who gave us feedback and direction on what kind of resources they needed to see helping guide these early stages of the campaign. And really the insights we got were that we needed to have very turnkey resources that could be adapted into existing wellness programs, and really to drive home the impact of migraine disease on employers' bottom line, and how really providing support and resources to their employees who are living with migraine can have a number of benefits, both for employee retention, which Paula touched on, in that first session, as well as employee satisfaction, and of course increased productivity, which we heard about from my colleague Todd. So if you go here, this is our example of the site that we built. And if you were to click on for employers, we don't have time to go to the employee section, but if you were to click on employers, that will bring you to the next slide, which is this one here. And we basically, this is a quick overview here, but if we advance one more, this will give you a sense of what those resources actually are, and I encourage you to spend some time with this resource. I know that Paula made a mention during her interview about why hire a job candidate with migraines. We also have some really simple suggestions on improving workplace conditions and employer self-assessment, some IBI research. We found, and Todd touched on this too, that there are a number of examples where a corporation of any kind of size has implemented support through a wellness program, through targeted programs, through women's groups, where we have found that employers who invest in supporting their employees with migraine have really beneficial results. And that's, in terms of the severity of the employees' migraines, there are a number of work days where they have to call in sick, and of course in the effectiveness of that employee doing their job. So we've found that to be sort of the sticking point here, and we sort of built these resources on the website as a way to educate employers in the most efficient way possible. Now I want to get to the next slide, where this is really the most important thing. And if there's one thing you take from this webinar, I hope it's this. We would love to be able to hear from you. And so many of you on this call are already leaders advocating for inclusivity, health, and productivity in the workplace. And if you've been listening to this presentation and wondering how you can help, the answer is come talk to us. And you'll have the contact information at the very end of this presentation, but we are in the process of developing a business council for migraine progress, which will be largely comprised of companies committing to supporting their employees with migraine disease. So what we're really looking for is that if your company is doing something innovative or interesting to support a specific employee or a group of employees with invisible diseases, we would really love to hear about it and even spotlight it on our website as we grow this Business Council for Migraine Progress. Stacy, if you could just advance to the next slide, I'll show you the different verticals that we are targeting. So our goal here, you see these 15 verticals. We are looking to build out one business representative from each of these sectors to serve on this Business Council for Migraine Progress. And really, we see it almost as building towards a similar format as you may have heard, like the CEO Cancer Roundtable. We believe that bringing the decision makers on board to be collaborators as part of this process to build better workplaces is really where we're going to have the most effective strategy possible. And so we looked at these major sectors and thought this is where we want to focus in terms of building out this initial business council. And in terms of what if you're interested, obviously we'd really love to hear from you and some feedback on this. But just to give you a sense of what we're hoping to do with this council specifically, we do think that there's a lot of opportunity for best practice sharing across industries. We would love to enable phone briefings featuring guest speakers about different gender pain disparities, health, women in the workplace, invisible diseases, and really spotlight the efforts of some of the most progressive companies in this space who are doing really wonderful work to support their employees with invisible diseases. We are planning to reach out to you all after the webinar to get some thoughts and insights about how to make this work for you and for employers in general, and we'd really love to hear from you. We do hope that you'll use this opportunity to demonstrate your company's continued leadership on an issue facing so many workplaces. So I think in the interest of time, I'm going to leave it there for questions.
Wonderful. Yeah, so we will turn to questions. I'm going to leave our contact info up while we're asking or answering questions. And let's see. The first person says, have you had any success with those who suffer from hormonal migraines? If so, can you share how you accommodated the situation? I think that might be for Todd, although maybe Paula could also chime in.
Yeah, I think probably be a good one for Paula. I don't have in my forefront of my brain a recent accommodation for that, but I could say that, you know, having a neutral third person away from the employer where it's confidential to talk about what the issues are and then figure out in the work environment what could be adjusted, as well as look at maybe adjusting their time at work where they can leave earlier or come in later on some days when they have the issue come up. That's all good to do to create an open dialogue and a safe environment for them to discuss.
Yeah, it's Paula. That's a great question. And one of the things that we have learned from the experts who we've interviewed with the Migraine World Summit about hormonal migraine is that reducing exposure to all the other triggers can oftentimes make hormonal migraine a much more manageable condition. So a flexible time from work is definitely a good one, but then reducing all of the exposures to other triggers like like light as an example, or smells or sounds, or things that are controllable variables, food or good, ensuring that they actually get to a doctor who can help them work through that and potentially balance some of their hormones and even out the spikes would be an excellent next step.
Perfect, thank you. Another question here was, how do you perceive the employer's responsibility toward the workspace when the TM works exclusively from their home office? Is it enough to provide helpful guidance, or is there more of a requirement to provide actual specialized equipment? Again, I think, Todd, is that something you could answer?
Yes, we regularly work with people who work from home, and we provide the same accommodation services. We look at where their primary work area is, and if they split their time evenly, we're going to equally address the situation and identify the triggers in the environment, adjust the lighting, make sure, for example, LED lighting isn't at eye level underneath an overhead flipper file. We find that those types of things can exist, and we make sure that we establish the optimum environment for them.
Wonderful. And there was a question about whether a recording of this webinar will be available. Yes, it will. I think it'll be offered through HR.com, but it'll also sit live on AIMD Alliance's website, which is aimedalliance.org. And then the next question was, can veterans be added to the list of panelists for the council? Louise, do you want to answer that?
Sure. I think that's, first of all, that's a great idea, and we love to connect up about that. I see, we've had a lot of research that obviously that's a group that does suffer from migraine in a disproportionate way. Our approach was to help support those individuals within those existing sectors, but we'd love to connect offline. I have your information about ways we could engage the military in some other ways.
Wonderful. I'm just going to check the chat and see if there were any questions there as well. It doesn't look
Stacey,
like
can I
jump
in? Stacey, can I jump
in
on the question about the home workspace?
Absolutely.
First of all, I think it's terrific that you're providing a person with migraine the opportunity to work from home, because I think that gives them the flexibility to manage through the ebbs and flows in their attacks. But what would probably be really encouraging to that person is to have an occupational therapist come out and do an audit of their home work environment. And then we have a list of accommodations. I believe we have it on the Migraine at Work website. If not there, we have it on migraineagain.com, of different accommodations that are reasonable and can be provided to that person, because it will vary what each person will need.
Perfect. Thank you. I think it looks like that's all of our questions. I just want to thank all the participants today. I think you provided a lot of very insightful information that will hopefully be useful to those who have tuned in. And we also want to thank our sponsors, which were Amgen and Novartis. And as I mentioned, you can contact any of us. And we just want to thank everybody again and have a good evening.
And on behalf of HR.com, I'd like to thank AIMD Alliance, the Headache and Migraine Policy Forum, and Migraine at Work for presenting this very informative webcast today. I'd also like to thank our audience for joining us. If you'd like to view this webcast again, the archive recording and slides will be available for up to 7 days for our free members. And if you have a recertification or an HR Prime Plus membership, you will enjoy unlimited access to all of our webcasts and events. The webcast credit will show up in your HR.com account within 1 to 2 business days, and we'll also be sending you an email with the credit information. Your feedback is important to us, so please take a moment to fill out the exit survey that opened in a new browser page on your computer. And this concludes our webcast. Enjoy the rest of your day.